Hi group and welcome to Unit 13. Today we're going to talk about the autoimmune diseases. These are disorders in which the immune reactions develop against one's own tissues or cells. The immune system cannot discriminate between self and non-self. 10% of the population has an autoimmune disease. So in autoimmune diseases, immunoglobulins or T cells display specificity for self-antigens. Some factors that may influence the incidence of autoimmune diseases would be things like genetics, age, and external factors or exogenous factors. Commonly, the cause of an autoimmune disease is unknown. The immune system's ability to discriminate between self and non-self can be jeopardized because of the following reasons. The first reason is neoantigens. So autoimmunity can be influenced by neoantigens, and a neoantigen is basically an altered antigen. This is an existing antigen which has been altered by chemicals such as toxins or drugs, or an antigen that has been altered by ultraviolet light, heat, cold, or pressure. The immune response is directed against this altered antigen. Autoimmunity can also be influenced by sequestered antigen, which is a hidden antigen that normally never comes into circulation. Some condition causes the release of these antigens into the blood. It's a hidden antigen that normally never enters the circulation. For example, the proteins of the lens of the eye, reproductive system proteins, and heart tissue proteins. Some conditions can cause the release of sequestered antigens into the blood. Autoimmunity can be influenced by maturation antigens and also cross-reactive antigens. A cross-reactive antigen is a shared antigen or a foreign antigen which cross-reacts with a normal antigen. This is called an antigen hybrid. Autoimmunity can also be influenced by mutated antigens. For example, B and T cells can mutate, and so can macrophages. They can all mutate. A loss of self-tolerance may contribute to autoimmunity. And this loss of self-tolerance can be seen in these conditions: a deficiency of T suppressor cells, or in a condition where there is an excessive number of T helper cells. The body now won't tolerate antigens that it should recognize as self. There are a number of different organs and tissues that can be affected by autoimmune disorders. Those would include cardiac tissue, stomach and intestines or the gastrointestinal tract, liver, brain and central nervous system, the thyroid, the skin and connective tissues, and also the reproductive organs. So let's go ahead and start by talking about the thyroid autoimmune diseases. So the thyroid autoimmune diseases are thyroiditis, Graves' disease, and Hashimoto's disease. Thyroiditis is generally seen in females ages 30 to 50. Some symptoms of thyroiditis would be fatigue, weight gain, and feeling fuzzy-headed. They may actually be depressed as well. Folks that have thyroiditis have an enlarged, firm, or hard thyroid, and they make specific antibodies to specific antigens of the human thyroid. They make what's known as anti-thyroglobulin antibody. They make anti-microsomal antibody, which is a component of the thyroid epithelial cells. They make anti-CA2 antibody, which is colloid antigen. And they also make anti-thyronine, which is T4. So all of these types of antibodies that are autoantibodies in thyroiditis can be treated with thyroid hormone replacement. Graves' disease is characterized by a hyperactive thyroid gland. This is called hyperthyroidism, where the thyroid is constantly stimulated. These patients have enlarged thyroid, a protruding eyeballs, and an overactive nervous condition. Okay, so these patients are overactive, nervous, they have enlarged thyroids and protruding eyeballs, and they make antibodies to thyroglobulin and microsomal antigens. Okay, so because of excessive thyroid hormones produced, these antibodies are produced, and that would be anti-thyroglobulin and anti-microsomal. These antibodies react with the thyroid via thyroid-stimulating hormone receptors to produce chronic, long-lasting thyroid stimulation. In Hashimoto's disease, our patients have fatigue, they're sluggish, they have pale, dry skin, and a puffy face. They may also have muscle aches and stiffness. They have a very hypoactive thyroid gland, and it usually strikes middle-aged females, but can actually occur at any age. The antibodies produced against thyroglobulin, microsomal, and CA2 antigens are anti-thyroglobulin, anti-microsomal, and anti-CA2. The disease is characterized by a reaction of the immune system against the thyroid gland. The thyroid gland is moderately rubbery and enlarged. Now let's go ahead and talk about the two central nervous system autoimmune diseases, and those would be multiple sclerosis and myasthenia gravis. Multiple sclerosis is characterized by partial loss of vision and muscle coordination. They have what's known as facial palsy, which is muscular incoordination of the face. They have lesions in the central nervous system, and this consists of monocytes that destroy the myelin sheath of the nerve cells in the brain. Destruction of the myelin sheath of the nerves is one way that we can help diagnose a patient with multiple sclerosis. The antibodies formed are against the myelin sheath, and here we see a decreased amount of T cells and an increased amount of B cells. That's what their lab tests reveal, and increased IgG levels. Okay? You are going to see an anti-myelin sheath protein, and that's going to be increased in the cerebral spinal fluid. There was a new theory that was outlined in 2013 that Clostridium perfringens exposure could actually lead to multiple sclerosis. Myasthenia gravis is a gradual progressive weakness of the striated muscle. You can see that the ocular muscles are affected in this disease. These patients present with weakness and fatigue due to neuromuscular dysfunction. The IgG class of antibody is usually involved in this disease, and the antibodies formed are against the proteins present in the muscles. So patients have muscle constriction and strength that are impaired. They have ocular muscles that are affected, and they also have facial, pharyngeal, and skeletal muscles that are affected. They have anti-protein and striated muscle antibody. The gastrointestinal autoimmune diseases that I wanted to discuss today are pernicious anemia, ulcerative colitis, gastric atrophy, and Crohn's disease. So let's start with pernicious anemia. Patients that have pernicious anemia present with inflammation of the gastric mucosa. They have an inability to secrete HCl, intrinsic factor, and pepsin. Intrinsic factor is a substance found in gastric juice which helps the absorption of B12. It makes that absorption of B12 possible. So these people have the inability to absorb B12. The antibodies in this particular type of disease are anti-intrinsic factor antibodies. Ulcerative colitis is another gastrointestinal autoimmune disease. Here we see inflammation of the mucosa of the colon. Patients have diarrhea and fever and dehydration. The antibodies are formed against the epithelial cells of the intestine. IgG is the class of antibody that is involved. In 2016, there was an article that suggested that Mycobacterium avium actually leads to Crohn's disease, and there may be a vaccine that's in the work to eradicate ulcerative colitis. We've got two types of liver autoimmune diseases. We've got biliary cirrhosis and chronic active hepatitis. In biliary cirrhosis or primary biliary cirrhosis, we have chronic impairment of the bile excretion. The bile ducts are progressively destroyed. The antigen in the test is the distal tubules of the rat kidney, so that's why we're talking about these patients have anti-mitochondrial antibodies. In chronic active hepatitis, our patients are producing anti-smooth muscle antibodies. The antigen in this test is rat stomach muscles, which is why they produce anti-smooth muscle antibody. This is a chronic impairment of the bile excretion, and the bile ducts are progressively destroyed. There are autoimmune diseases to the reproductive organs, and the antibodies produced against the adrenal cortical cells, ovarian, theca, internal cells, and sperm would be antibodies like antibody adrenal cortical cells, anti-ovarian theca internal cells, and anti-sperm antibody. We also have a group of diseases called the autoimmune hemolytic diseases, or the AHAs. We've got antibodies formed against patients' own red blood cells, and those are called warm antibodies or cold antibodies. Warm antibodies are reactive at 37 degrees Celsius. Usually they're the IgG class antibody directed against the Rh antigen on red cells. Our cold antibodies are actively poor at body temperature but reactivate at 4 degrees Celsius. Usually they're the IgM class, and they are seen in atypical pneumonias, mononucleosis, and cold agglutinin disease. We also have thrombocytopenic purpura, which is an autoimmune hemolytic disease where we see patients with a low platelet count because their platelets are lysed and destroyed, and that is induced by the exposure to black flies. And then finally we have neutropenia and lymphopenia, where we see antibodies that are formed against the patient's own neutrophils and antibodies that are formed against one's own lymphocytes. We also have a couple autoimmune diseases to the skin that I want to talk about, and we've got pemphigus and vitiligo. Pemphigus is relatively uncommon. It's an autoimmune disease where the autoantibodies attack the glue that holds the skin together. This is a blistering skin disease where you see big red blisters, and the antibodies are formed against the epidermal cells. In vitiligo, this is a condition of the skin, a condition of skin depigmentation. The pigment-producing cells are destroyed. The treatment for vitiligo is steroids or photochemotherapy, and 40 to 50 million people have vitiligo in the United States. And just for fun, I'm throwing in a couple miscellaneous autoimmune diseases, such as scleroderma and Goodpasture syndrome. So scleroderma is a miscellaneous autoimmune disease where you see chronic hardening and shrinking of the connective tissues. This affects any organ and the cause is unknown, possibly antibodies produced against lymph cells which stimulate collagen. In Goodpasture syndrome, we see an autoimmune disease that affects the lung and kidneys. There are antibodies formed against the lung and kidney tissues, and these tissues hemorrhage and impair gas exchange, and death results from respiratory and renal failure. Here I want to discuss two connective tissue diseases. I want to discuss systemic lupus erythematosus and rheumatoid arthritis. Systemic lupus erythematosus is a word that means red wolf. It's an inflammatory disease where collagen is destroyed and the collagen that binds to capillaries and small blood vessels disappears. This is a chronic disease which may have periods of remission. Some symptoms of systemic lupus erythematosus would be fever, tiredness, joint pain, small ulcerations of the fingertips, pleuric pain, and nausea and vomiting. This is a systemic disease where collagen is destroyed, and sometimes our patients present with what's known as a butterfly rash around the face. Okay. Usually the most prone patients to systemic lupus erythematosus are 10 to 40-year-old females, and it is a chronic disease of the T cells. Here we have damaged white cells that release nuclear material which is engulfed by the LE cell. The LE cell can be seen sometimes on a peripheral blood smear. Serum in lupus patients contains anti-nuclear factors. Patients eventually die of renal failure due to deposited immune complexes in the glomerulus. And the antibodies associated with systemic lupus erythematosus is anti-nuclear antibodies, anti-SM antibodies, anti-DNA antibody, and especially anti-double-stranded DNA antibody. We're going to talk about anti-nuclear antibodies momentarily. In the connective tissue diseases, we can do what's known as an anti-nuclear antibody testing. Anti-nuclear antibodies are going to react with nuclear components of cells from many species. Okay? They can be detected by observing fluorescence of the cell nuclei using a fluorescent microscope. We can have human or animal epithelial cells or tissue cells that are donor cells and used for nuclear pattern observations. So what we can do is we can look at different fluorescent patterns on the nucleus of donated cells and determine or help diagnose what condition our patient has based on our observations. ANAs, or anti-nuclear antibodies, are antibodies directed against components of a cell's nucleus. Anti-nuclear antibodies can be seen in systemic lupus erythematosus, rheumatoid arthritis, scleroderma, and other autoimmune diseases. So we look for anti-nuclear antibodies by detecting or observing fluorescence of the nuclei. And you can see that here in these images. We have some that are homogeneous patterns, such as the top image on the top left, and then next to that where it says AC3, we have a speckled pattern, and so on. So the main patterns that I want to discuss are called homogeneous pattern, peripheral pattern, speckled pattern, and nucleolar patterns. Okay? So if you have a donated cell with a nucleus that stains entirely, usually that is associated with rheumatoid arthritis or lupus, and that's called a homogeneous pattern. Okay, then we have what's known as peripheral patterns, or rim pattern, where the nucleus is going to fluoresce especially around the periphery, and that is seen in active lupus erythematosus. Then we have a speckled pattern where you see numerous specks of fluorescence in the cell nucleus, and that generally indicates rheumatoid arthritis or lupus. And then we have nucleolar antibodies, or nucleolar patterns, that indicates a progressive systemic sclerosis type of disease. Okay, so let's take a look at some of these patterns. All right, so here's some images of different anti-nuclear antibody patterns. And here, the only thing that's staining in this image is the nucleus of the cell. You cannot see the cytoplasm. So on the top left, we see a homogeneous pattern. And again, that homogeneous pattern is when the entire nucleus fluoresces, and that's associated with nonspecific rheumatoid arthritis or lupus. Then in the image next to that is called the speckled pattern, and the speckled pattern is usually associated with anti-SM or anti-RNP antibodies, okay? And that's associated with rheumatoid arthritis. In the bottom left, we have a peripheral pattern, or a rim pattern, where the antibodies to DNA are intensely staining around the edge of the nucleus. Okay, and then on the bottom right, we have a nucleolar pattern where antibodies of ill-defined specificity are identified because of this nucleolar pattern. Usually this indicates a progressive systemic sclerosis disease. So for anti-nuclear antibody testing, it's actually pretty easy. So what we want to do, and there's two different types of fluorescent stains. One is called an indirect fluorescent antibody stain, and one is called a direct fluorescent antibody stain. Okay, this happens to be an indirect fluorescent antibody test, where we mix the patient's serum with the donor cells, and we put those on a slide. We incubate them and wash off excess serum, and then we add a fluorescent tagged antibody. We incubate it again, and then we wash and air dry it and examine it using a fluorescent microscope. And then we look at the nuclear pattern and how it's staining. Other diagnostic tests for autoimmune diseases would be things like latex nucleoprotein agglutination, immunofluorescence, tanned RBC testing, fluorescent antibody testing, or indirect passive hemagglutination. These are all different types of tests that I'm not going to get into too much here for autoimmune diseases.